So reviewing the anatomy of the eye, this will help facilitate our discussion of the disorders next week. So these are, of course, this is your iris, the pupil, the sclera, and you have ducts here that connect with the more commonly called the nasolacrimal duct, meaning any tears or medications that you instill into the eye can run into the nose, into the nasal cavity. Here are the muscles controlling your eye. So when we talk about eye surgery next week, how many muscles must they manipulate in order to keep the eye still? Okay, so I don't want to show it because I can't stand watching the video. You can watch it for yourself if you're okay with it. So eye surgery is very brutal. Okay, so they'll insert, because imagine one surgical procedure is to put a band around the eyeball, a buckle, okay, scleral buckling. How do you put a silicone band here? Imagine that's inside. So therefore, how do they put that in there?
They slip it from the side.
Okay, so if that stop. Okay, that's okay. Thank you for describing. I can't imagine that, but so it's a very traumatic procedure, right? So therefore, yeah, they get anesthesia, local anesthesia. That's it. So therefore, what will happen to the eye after surgery? What will it look like?
Swollen.
Okay, so very swollen, red, bloodshot. Okay, so will there be discharges? A lot of discharges. Okay, so so when we discuss pre and post-op care next week, so you can understand what they do. Okay, so there are, of course, expected findings, and then you should differentiate between, okay, yeah, that's expected because of the trauma of surgery versus what are reportable signs and symptoms. Okay, so we'll do that next week. Inside the eye, so when next week when we discuss the glaucoma, so when the glaucoma says open angles or closed angle glaucoma, narrow angle glaucoma, the angle that they're talking about is this. So these are the angles. What are angles? They are actually openings for the canals through which your aqueous humor drains. So what is aqueous humor? So it is the liquid inside your eyeball. So this is constantly produced and drained to maintain the shape of your eyeball. And here are the, how does the eye allow you to see? So the brain interprets the vision through the optic nerve. So this is your optic nerve here, supplied, of course, by blood vessels. So these are microscopic vessels supplying the retina. And so this is the retina. So it's a thin layer of tissue that contains all the receptors connected to the optic nerve. So what you're seeing now, let's say you're seeing me, you're seeing the board, and that is interpreted well, the light hits your eye first, and then reflected against the retina, and then the image is interpreted by the brain. Okay, so that's how vision is made possible. A central part of the retina is called the macula. It's right here, right in the middle. So if you're looking at it here, so it's straight in the back of your eyeball is the macula. So next week we'll be talking about the disorders wherein there is a blockage of the angles. Okay, what are the angles again? These are canals. Okay, these are natural canals or passageways for your aqueous humor. So we'll discuss next week what happens when the patient has which type of glaucoma and how does it damage the vision? What does it cause blindness? So what does it do to the intraocular pressure? And in the case of the retina, so we'll discuss the disorders, which are retinal detachment, usually caused by trauma, or retinal tears, or macular degeneration. We have two types. We have dry macular degeneration and wet macular degeneration. Okay, so those are the eye disorders we will cover next week. And of course, the management will either be medications or surgery. With medications, just like any other medication, what are you always tested on? Nursing responsibilities first, and then your teaching, right? That includes patient teaching, right? Because for, let's say, glaucoma, the eye drop administration is lifelong. It's forever. So is it crucial that they know how to correctly administer eye drops? Okay, so we will discuss those next week. So we will review for the eye. So we will review how to administer eye drops, how to administer eye ointments, and again, pre and post-op care for patients undergoing eye surgery. Now for the ears, we will do the same. So for patients who have ear surgeries or eardrop administration, do we know how to administer ear drops? Okay, so we'll review that. Ear irrigation as well. And then again, pre and post-op care for people who undergo ear surgeries. That's it for today.
Thank you.
Thank you.